We delve into the pressing concerns surrounding emerging viral threats and the measures being taken to address them. In recent months, Texas has experienced a significant surge in measles cases, with 223 reported infections and 2 fatalities among unvaccinated individuals. Neighboring New Mexico has also reported 33 cases, and additional infections have been linked to this outbreak in Oklahoma. Measles is an extremely contagious virus that spreads through the air when an infected person breathes, sneezes, or coughs. Symptoms include high fever, cough, runny nose, red eyes, and a characteristic rash. The Centers for Disease Control and Prevention, CDC, emphasizes that vaccination is the most effective form of prevention. They recommend the MMR, measles, mumps, and rubella vaccine, with a booster suggested for those at high risk in outbreak areas. Health officials are particularly concerned about the rise in measles parties, a dangerous practice where parents intentionally expose their children to the virus, reminiscent of similar events in the 1970s. Medical experts strongly advise against this, citing the risk of severe complications, including encephalitis and death, especially among unvaccinated populations. Norovirus, often referred to as the winter vomiting bug, has been making headlines due to several recent outbreaks. A notable incident occurred aboard the Coral Princess cruise ship, where 69 passengers and 13 crew members fell ill during a 16-day voyage from California to Florida. This marks the second outbreak on this vessel this year, with the previous one in January. Norovirus is highly contagious and spreads rapidly through close contact, contaminated surfaces, and food. Symptoms typically include sudden onset vomiting, diarrhea, and stomach pain. In Ireland, health authorities have issued warnings following a spike in cases, urging those affected to stay home for at least 48 hours after symptoms subside to prevent further transmission. In response to the rising cases, a new oral vaccine is undergoing trials. Developed by Vaxart in San Francisco, early results indicate promise in generating specific antibodies in older adults. If successful, this pill could become available in the coming years, adding a valuable tool in combating norovirus outbreaks. Rwanda has recently faced its first ever outbreak of Marburg virus disease, a severe hemorrhagic fever similar to Ebola. The outbreak originated in a tin mine near Kigali, inhabited by approximately 10,000 bats, known carriers of the virus. The initial case was traced to a miner who had been working in the affected area. As of October 2024, Rwanda reported 66 confirmed cases and 15 deaths. Health authorities responded swiftly by closing the specific mine tunnel housing the bats and implementing measures to minimize human-bat interactions. Additionally, over 700 vaccine doses were received for trial purposes, prioritizing healthcare workers and individuals who had contact with confirmed cases. By December 2024, the World Health Organization and the Rwandan government declared the outbreak over after no new cases were reported for 42 consecutive days. Since December 2023, there has been a significant outbreak of Oropouche fever, primarily affecting Brazil but also reported in Bolivia, Peru, Colombia, and Cuba. This marks the first occurrence of the virus outside the Amazon region. Oropouche virus is transmitted by biting midges and can cause symptoms such as fever, headache, nausea, and joint pain. As of August 2024, over 9,852 infections have been reported, with 2 fatalities. Notably, cases among travelers to the region have been identified in the United States and Europe. Health authorities are monitoring the situation closely, especially considering the potential for vertical transmission from pregnant mothers to fetuses, which has been linked to stillbirths and possibly microcephaly. An epidemic of a new variant of clade Mpox, formerly known as monkeypox, referred to as clade 1b, began in Central Africa as early as September 2023. As of 2024, more than 29,000 cases have been reported, with over 800 fatalities, nearly all in the Democratic Republic of the Congo, DRC. The World Health Organization declared the epidemic a public health emergency of international concern on August 14, 2024. This variant has shown a higher fatality rate compared to previous strains, and a significant number of cases have been reported among children under 15. Efforts to control the outbreak are ongoing, with vaccination campaigns being implemented in affected regions. In the realm of COVID-19, a new Omicron subvariant of SARS-CoV-2, designated BA.2.86, has garnered attention due to its significant mutations. First detected in a sample from July 24, 2023, BA.2.86 possesses over 30 mutations on its spike protein relative to its predecessor, BA.2. This extensive mutation is comparable to the evolutionary leap observed with the original Omicron variant. The World Health Organization classified BA.2.86 as a variant under monitoring on August 17, 2023. Its descendant, JN.1, BA.2.86.1.1, became the dominant lineage in the winter of 2023-2024. Researchers continue to study this subvariant to assess its transmissibility, immune evasion capabilities, and potential impact on public health.